I was talking about the heart, right? How was the heart? We have chambers. How many chambers?
4.
Yeah, very good. What is this chamber called as?
Atrium.
Which atrium? Yeah, this is right atrium. This is?
Ventricle.
What is this?
Ventricle.
Ventricle. Right ventricle. This is? Left atrium. Very good. This is left ventricle. Okay. So, how many walls we have? Walls?
4.
Walls, yeah, 4. So, one is here, tricuspid. Tell me the names. Another one here. What is it? Pulmonary valve, because it goes to the pulmonary, right? It goes to lungs. Remember?
Yeah.
Another valve here. What it is called as? Mitral valve. Another aortic.
How do you call this one?
Mitral. M-I-T-A-L.
Okay.
And here one, it is aortic wall, right? You remember, right? Okay, just tell me where this connections goes now and what oxygenated and deoxygenated it carries. Something comes from the downside of the body is called as inferior. Something comes from the upper body, it's called as superior, right? From my head, nose and shoulders, superior. Comes from the downside of the heart, called as inferior. Getting? My heart is here, down from the hand, because everything has to come from the downside. It is called as inferior. Something comes from the upside, it's called as superior. Don't have to remember much, but we have to know the valve. Okay. So, where this goes to lungs, right? Deoxygenated blood. Oxygen is not there. Here also deoxygenated. No oxygen, right? Tricuspid opens, comes here, it goes to the lungs. Do I have to explain this? No again, right? From here it comes, it's oxygenated. From lungs it comes here, right? Oxygenated. Like here is a space.
It comes, yeah, you mean, yeah,
Yeah.
from this tube.
Yeah. So this tube, it comes from the lungs. Pulmonary lungs, pulmonary veins, right?
Okay, yeah.
Oxygenated. Huh? It comes here, mitral wall, which allows it to go down. This is going to pump everywhere in the body. Clear? From where it pumps, it goes from the aortic valve. Right? Clear?
Yeah.
Any doubts? Any doubts?
No.
Any doubts? No. Right. Clear.
From the, what is it?
For that you have to attend your anatomy class, sir. Because they have learned it in anatomy class. What happens exactly? There is a, I was talking about systolic and diastolic, right? Okay. Now you have to answer me. Okay. When my heart compress, okay, the pressure will be high or low. Just use your logics, nothing else. No terms, nothing. Just my heart is compressing. My pressure will be high or low.
High.
Where my pressure will be high? On which place?
On the arteries.
Where exactly? So artery is my pressure. So where my, when my,
Whole body, so the blood.
yes, exactly. So when my heart is getting compressed, where exactly my blood is going to be thrown out? Which place? Just tell me. Tell. Compressed. From which valve it is going to open?
Aorta. I don't know the name of the vein.
Just show me this. I'll name it like tricuspid as 1, 2, 3, 4. Yeah.
From all.
Okay. Yeah. Okay. Valve, the hole, the opening.
From all, she said from all.
From all? Huh?
From the third.
Think.
It goes in. and
From
goes
third,
out.
very good. So when it is compressed, it is basically going to be from third and 2.
Yeah. Yeah.
2
okay,
and 3.
That's what I meant.
Right?
Yeah.
Both.
Yeah.
So, yes, but outgoing, where this thing is going where? To the lungs.
Yeah.
This thing is going to be the heart. So, That means in systolic pressure, both the circuits are active, systematic and pulmonary. What is pulmonary circuit? To the lungs, systematic to the rest of the body. You remember? Make sense?
Systolic,
High pressure.
systolic is to the
What circuits are going to active? Upper one pulmonary to the lungs as well as to the body. Pulmonary, this is going to take 2. Systematic, 3 is going to take. Clear?
systematic is going to the body.
Systematic is going to the body. Systematic is this one, to the cells. Pulmonary is this one, to the lungs. Lungs. It's clear? Any doubts?
So whenever heart is compressed, the blood circulation get more.
It's called a systolic pressure. Systolic pressure is, now what is, have you heard about the value of systolic pressure? Yes. Have you heard about 120 mmHg? Have you heard what is the normal hypertension value? Yeah, what is that? 80 by 120, right? Have you heard? What is your normal, what is your body's normal temp?
120, yes, right. Yeah.
So what is systolic in it? 120. So what we are measuring here is when the heart is getting pumped is 120 mmHg.
And we usually put 120 before 80. So we will say like
Don't even think about 80. I have just written 120. You are not even thinking about 80 right now. You are just thinking about 120.
so that's 120 is
What it is? Systolic. What it is exactly? When my pressure is high, when my heart is compressed. Clear this much? Any doubts?
what is it 120 then?
Leave.
Leave.
Just think there is something called as 120. Okay? Just leave. Now, what is my next mechanism? Once my compression is happening, my heart is opening. That is called as diastolic. In that, which are the walls which are going to get activated?
2 and 4. No, 1 and 4.
1 and 4. That means my blood is within the heart. My blood is not going out of the heart. My blood is within the heart. Which are the chambers which are getting opened? The upper chambers. Upper chambers. But in both the cases, one is oxygenated, another one is deoxygenated. So both the wall which are getting activated in diastolic have different bloods in it. One is oxygenated, another one is deoxygenated, right? So one is deoxygenated, 2 is oxygenated blood. That is high pressure or low pressure? Low pressure. That's why the value is lower than this. That is 80 mmHg. And now coming to what is this value?
So when his blood is within the heart,
When the blood is from upper chamber to lower chamber, the cuspids are opening, that is called as diastolic. The pressure is low. When the heart is pumping it outside, that is called as systolic.
120 value.
That is, no, normal 120 it is. Normal it should be 120 mmHg. What is this mmHg? Yeah.
So it's systemic circulation or
This, what is it? What is it? We have measured it based on the mercury. You know mercury? What is mercury?
yes. No.
Okay. What is that? You know something silver in color, in the room temperature, and you have this BP machine, it just runs up and down, there is a silver spot in that BP machine. It is an element, it is a chemical, you can say it is an element basically, which is in liquid state in the room temperature. Okay. So what happens in mercury, it's very toxic, you know, when you take it, it has the property to destroy the cells completely. So they used in thermometers. Have you seen thermometer?
Yeah.
Yeah, thermometer, they keep temperature, it goes up. Yeah, that is mercury, right? Yeah, in the same way, they keep one in blood pressure to measure the blood pressure. Okay, what do they do? Now, where this, I told you where this can be measured, you remember? You remember? Yeah. So from what is the connection? The connection goes like from heart to the hands to the entire body, but the measurement can be done in the hands. When we check the pulse, that is, I'll come to that. This, so the major aortic artery which brings it there, we can measure it here. The second is here. So we have two. One is, so that is branches coming out of this aorta. Branches coming of this aorta. Aorta has, you understand where this aorta is? Who is bringing my, it's the biggest, most biggest artery in the, because it has high pressure, right? It divides into the branches, which takes to the different level. First level to the upper body, second branch is to the lower body. First branches, then again branches. This branch is called as carotid artery. Carotid artery. Okay. The blood supply to my head, my neck, my face, everything goes through a carotid artery. Another part goes down everywhere else. So I have two receptors present. One is in the carotid artery to measure the blood pressure in my body, another one is on my aorta. Baroreceptors are very important to understand in case of hypertension, because the thing which gets affected to not identify the pressure happening in the body, the pressure variation happening in the body is the baroreceptors. Okay, if it cannot identify, then my everything will be spoiled. My body cannot understand what is the pressure I have to create, because a person who is in the sleeping position do not generate the same pressure of blood from the heart who is standing, because it is against the gravity. And baroreceptors are the one which identify whether you are standing, sleeping or sitting. Clear? These are nothing but some proteins receptors. Clear? Any doubts? Till this? No doubts. Now, coming to this, I have put one pressure identification mechanism here. Okay. Now, what did I say? For example, this is my blood vessels, right? My blood vessels, the pressure comes from here, the blood rushes here through my blood vessels. My wall exerts some pressure against this blood. Okay. And if my wall, my cells of the wall, epidermis cells are not capable, it's broken, it's damaged, it cannot create that pressure, what will happen? My blood pressure is so high that it can burst out. It can burst the capillaries, it can burst the arteries. Artery itself can be burst.
It also happens sometimes up here, right?
What are the major parts gets affected? Brain, heart, kidney. Why? Because these are the parts where mostly the blood circulation goes, and if these parts get affected, the body will be completely ruptured. So when it comes to brain, the blood vessels goes to the brain, breaks, it causes stroke. So high complication of hypertension is stroke. You getting? Pressure is high, my walls are not able to resist it, it will go inside my brain, it will break there. So stroke, hypertension above 220 mmHg of systolic pressure may cause rupture. So rupture is breaking, just blood comes out. Okay, rupture is just breaking.
In the heart.
Yeah. So we have put a measurement from 0 to certain level to understand how much pressure is generated. You have heard about autoclaves. You have heard about pressure cookers which we use in kitchen. Pressure cooker. Okay. How do we measure the pressure inside? Have you thought about it? Oh my God, what would be the pressure inside? How does it increases the temperature? Do you think the open container has the same temperature in it the way it is maintained in the pressure cooker? No. Why? Because temperature is directly proportional to the pressure. More pressure you have, more temperature will be high. Boyle's law, right? Have you heard about that? P equals to directly proportional to, okay, That we learn. Okay. It's like wherever we have generated pressure, we have that's the basic principle of pressure cooker. So what we do, we close, we generate the temperature in it. Because of that, the pressure increases. Because of that, pressure increases, the temperature. In the normal open system, how the temperature should increase? No, it's not increases like that. It increases in more amount in pressure cooker. So time is less because of the pressure and it increases. So how do we measure the pressure? That is measured in the unit of whatever we are applying. Have you heard about atmospheric pressure? We have a pressure in atmosphere.
Yes.
Yeah. So how do we measure it? Baro. Exactly, barometer. So that is the value is like the unit is. Okay, so we normally measure the pressure in PSI, PSI, okay, pressure of something, I don't know, I remember it, okay. So that's how we measure the pressure on something. So in the same way, we measure the pressure in our system through millimeter. The length by Hg is the unit of, Hg is the SI unit of mercury. So millimeter mercury. Getting how much my mercury is going high.
Millimeter
Mercury. Clear? Any doubts until this? So we have put a scaling. The normal blood pressure should be, because always there will be pressure. The body cannot be without pressure. If the body is without pressure, that means he is dead. Okay, so blood is not circulating. So blood is circulating, always pressure will be there. So the range of normal blood pressure will be 80 and below 120. Systolic will be 120, diastolic will be 80. Clear? But the hypertension happens when systolic or diastolic goes high. In some cases, most of the cases, it starts from systolic. So above 120, we have now scales. We have scales like, yeah. When it starts going to above 120, we have stage 1, stage 2, stage 3. Okay. So the highest one is above 140. So when it goes to 140, this also changes according to the timing, okay? Because before it was so tell like 140 is normal, but now it's said like 120 till 120 is normal. Above 140, above stage 2 hypertension. Above 140, above stage 2 hypertension. They are proper hypertension. 120, okay, 120 is just starting. 130 is, you can say stage 1, 140 is stage 2. They have just categorized it.
So 120 is 130 is stage
120 to 120 it's normal, 130 it's stage 1, above 130 it's stage 1, above 140 it's stage 2. Okay?
I have a question.
Yeah.
So why is it
Getting, you don't move your hand in the same way you are not moving your leg, you will get the same sensation on your hands also. Why? Because the blood circulation is still there, but it is not working, so blood circulation is not in the same amount. So what it does, it has, the blood circulation stops there, but the nervous system also take a rest there because it has nothing to do with that part now. So the sensation is because of the nervous system, but it happens due to the blood circulation.
Because of not nervous system.
No. There is sensory neurons. I told you there are sensory neurons. So sensory neurons get activated when the cells are active. Okay. So for example, if you are sleeping, the same touch, you will not have the same touch when you are awake. So somebody has to, So that time what is happening? Your nervous system is taking rest, but at the first time, the muscular system is taking rest there. So your sensory itself is not active. Then it goes to CNS, then it goes to brain to work it, to make it work. So when you are closed system, your blood circulation is not working, the cell is at rest. So the sensory also takes the rest. It doesn't mean that blood is not supplied there, blood is supplied but not in the same amount.
Yeah, it's not a, okay. I don't know if I
So we
was
can say
explaining.
because of the blood flow in that particular part of the body, because of that, it's you are having the numbness.
No, it is because of the sensory organs. You have the numbness.
That means nerves by the
Yes.
Okay,
But because of the blood supply, the sensory organs are not working.
so that's numbness.
Okay.
What I was,
Because of the blood.
Blood circulation is lower down, that's why sensory nervous system is not working there. For example, if your sensory nervous system is damaged, blood circulation is still there, you will have the numbness. So it has nothing to do with blood at that
Okay.
time.
so what I was asking is actually the contrary. Like, I was not clear. Like sometimes, it's not even when I go to sleep. Sometimes when I'm tired, I feel like my legs are very heavy. Like, and it's like almost painful.
That
It's
is because if you are having,
not
you have
numbness.
heard about varicose vein, because people who stands for a longer time, they have this, all the arteries and veins just comes out. Why? Because the supply, the pressure it has to create from there, it's very high. It always creating that pressure. They're never crossing their legs. So the pressure they have to create is still very high. But then it has nothing to do with the blood supply, even though it depends on the blood supply. Okay, but nervous system is not getting affected in that case. So you are getting that numbness because of the because of the sensory nervous system.
So what happens when we are
To explain this again. If you have any doubt, please ask.
Yeah.
I'm just
checking
going to
what
stop.
numbness means. That's because.
Of the nervous system. Numbness is because of the nervous system. Blood,
Yeah, yeah.
ultimately what happens because of the blood, it can be because of the muscular system, it can be
can be also
it can be because of the muscular system also. You know, it gets into, and you work hard for something for a long time, you are working there, blood supply is so high, but then you will get numbness.
how it happens because of the muscle system.
Yeah, because muscles are connected with with nervous system a lot. Today we will read in anatomy and physiology how the nervous system makes the muscles to get activated. Any doubts till now? Okay, it's clear, right? So where we were supplying this to the, yeah. So diastolic, systolic is clear. Okay. So you understood the hypertension. Now we are, what will be the complications? Because myocardial infarction. What is myocardial infarction? If you have a burst in your heart, arteries or something or anything, it cannot supply oxygenated blood further. So wherever the burst is happening, because of that, the next cells get ruptured because the oxygen will not be supplied, energy will not be supplied. Clear? Any doubt in that?
What is called this
Myocardial infarction. You want me to write it? Myocardial infraction, IN. Okay.
because of because of this happens heart attack.
It can be one of the reason. Atherosclerosis can be another reason. Many reason. One of the reason can be myocardial, because the supply to the heart, heart is supplying blood to everywhere, right, throughout the body. Heart also needs blood. So there are small arteries coming out of this aorta to the heart itself, so that it can work. The cells of the heart should work. When the supply to the heart itself stops, this heart stops beating. What will happen? Ultimately, nobody is going to get blood. That is called as myocardial infarction. Simple. Okay? Is it clear? Is it clear? Just you don't have to go with the terms. You just
Too much fat.
sorry? Yeah. So obesity is one of the reason. Then very good. Come on. Yeah, very nice. Okay, then tell. Come on. Yeah. So it's inherited genetics. Yeah. Then very nice.
All are case study, right? Also like a real
Yeah, we'll do it in case studies basically, because all this diagnosis where you will check the how the person smokes, drinks, and then very important. Obesity, yeah, eating bad fat, yeah.
You can be not obese, but you
Yeah, you are not healthy. So what it is called as? Come on, come on.
Because of the respiratory also it can be case.
it's not
Don't mix up with systems, because one system damages, definitely the other system.
If their breath is not going there, the heart will
So that is basically a complication. When a person has hypertension, they can have a breath problem.
breath problem.
Yeah, they have some respiratory problem. That can be one of the complication, you can say.
cholesterol is involved.
No, cholesterol is involved. Okay, heart problems are involved, but then yeah, definitely it affects the hypertension. But don't mix up two systems together, because you are mixing two systems.
Why? Where is the cholesterol?
Because you said to us no, to
Cholesterol, you're getting into a little bit. Cholesterol, what happens? There is deposit.
Yeah.
Ultimately, what is happening here also? The diameter is reducing, more pressure, hypertension. Obesity, most of the time, the result may result into cholesterol deposit because it's a bad fat. Okay, so what happens in this case? Maybe the walls are not getting affected, but because of the deposition of fats inside those blood vessels, the pressure is high. It will cause the hypertension.
Okay. So hypertension is when the size is reduced
Because my students are now jumping from one concept to another, it's fully mixed up.
or ये
So,
blood pressure
because everything you are understanding, but you have to go step by step. Then only you will get a point. I was just talking about the risk factor right that time. You got into the mechanism. It's good. It's good because you are thinking more. But I was just talking what are the causes. It may cause the problems with the hypertension, right? So genetically also it can cause. It can cause because of the age. It can be because of the age. It can be because of the smoke. It can be because of the, now the main thing, food. Lifestyle changes. You will have the problem with the food also.
and too much sport can also
No, no, less sports.
less sports.
Yes.
But also too much, no?
Too much,
Like
no.
overextend,
Too much is not
overworking.
because of the hypertension. Too much causes what? Rupture of the muscles. The break. It breaks the complete thing. That time, the pressure is high, but it will not cause a long-term pressure. It is a permanent damage to the walls. But if you are getting some injury, that is not a permanent thing.
Can I ask you
Yeah, sure.
when
Much, then it goes to hypertension. When your diameter is reduced because of so many factors, don't mess up. You try to understand one factor after one. Okay, don't mess up all the factors together, because for everything we have different factors. Okay, because now the diameter is decreased, pressure is increased, hyper blood pressure.
when it decreases?
The diameter gets decreased because the pressure is high, because the thing which is passing through the pipe is high, has high pressure. My wall has to insert more pressure, so my hypertension automatically goes down, high, I mean. Irene, you have any doubt?
No.
Clear?
Yeah.
It's very clear, hypertension is clear? Okay. So, lifestyle disorder. If your muscles are not strong enough,
You mean muscles of the artery?
muscles of the arteries, because I told in arteries you have 3 layers of muscles, right? You have 3 layers. The first muscles itself is the smooth muscles, right? The muscles, everywhere you have muscles,
Yeah.
right? So your smooth muscles are not strong enough, or it doesn't have the amount of pressure in it. It cannot generate it. What will happen? Less pressure, it can go to hypertension. But when you have, there is another condition, okay? If you are lacking your exercise and you are not giving your muscles enough to create that pressure, it's like, there is 2 mechanisms of muscles, okay? Muscles have 2 mechanisms. One is it get contracted. Another one, it gets relaxed. Muscles can be elastic, muscles can contract. When you get muscle spasm, you know, cramps.
Yeah.
Muscles are not working properly, but there you get cramps. What is that cramps? Hyperactive. it is connected to the nervous system. You have heard about cramps, muscle cramps?
Yeah, not only hurt.
Yeah. Yeah. So what happens? Muscles has a property of working. If the muscles do not work properly, it can also contract unnecessarily. That contraction also can happen here, which can generate hyperactive. So lack of exercise can cause muscles to activate in both the directions. It can get loosen also, it can contract also. So for example, if a person who is doing exercise for a longer term, athletes or something, they all of a sudden they leave doing exercise. In that case, what happens most of the time? They'll get cramps. They get contractions in their muscles. Have you heard about it? When you are practicing for a longer time, all of a sudden you leave, for few days it's okay, but for a longer time you leave, you'll start getting cramps. First, because of electrolyte deficiency, because of the contractile. The people who lose lot of electrolytes, those who don't drink enough sufficient electrolytes, water, NaCl and all those things in their body, glucose, then they get muscle. Sometimes just because of when we are in the deep sleep, the muscles relaxes. Normally what should happen? The muscles should relax. But because of the electrolyte deficiency, the muscles get excited and you get sleep cramps. In calves, most of the time it's calves. Right? Why? Because calf is the major supply for the blood supply. You getting? Now? And your muscles are very active in calf muscles. Okay? Is it clear now? So what you have to do, that means your body is lacking electrolytes. Electrolytes are connected to your nervous system. Your nervous system has some mechanism through which they releases some ions which makes the muscles active. Okay? Done? It's clear. Okay. So what am I missing now? Let's go add you eat salt. What it has to do with the salt? What this whole procedure has to do with the salt? Nothing, but the kidney has a role in it. Hypertension. I was telling acid, yeah.
No. Go.
I was telling acid regulation, alkalosis regulation, everything is done by the kidney. All the water component comes inside, goes to the blood, is maintained. Blood volume, it is called as blood volume. So, hypertension, how it is related? If the volume is high, tension will be more.
If there is more volume
Blood.
of blood,
Hypertension.
tension will.
The pressure will be more because the body has to transfer this much volume now. You're getting?
Okay. Yeah.
Right? So, blood always regulates in a particular amount. Who regulates it? You, kidney. You have this much water drinking. This has to be diluted in blood, right? The water has to be diluted in blood. Who does it? Kidney does it. So, everything related to hypertension has to be honored by the kidney. Now, where this kidney comes after, sir, yeah. This Ayurveda concept, I'll talk sometimes else then. So, because it's a little bit going high. Okay, so we will talk in the thyroid because thyroid is a bit smaller. We'll talk about in the thyroid maybe. So, ahara, yoga therapy, okay? Okay, in hypertension, it is called as Ucha Rakta Chap, like high blood pressure. But then it is in how it is being categorized, like it's pitta based, okay, which result into the vata disorders because it's basically into the circulatory system. So what happens in the hypertension? Basically the thermoregulation is getting higher.
Right in English.
Oh, I'm so sorry. I'm so sorry. I'm so sorry. Pitta?
Vata disorder, right? Because of the vata disorder.
That's why we were asking too much questions. So then,
No, it's Sanskrit actually. Pitta. That this is how. Yeah, it's
yeah.
it's Devanagari Lipi. Because
Too easy. We have to increase.
okay, so Pitta and Vata. So what do we do?
So one question.
Yeah.
if the vata
Actually going to affect first is which vata? Which prana? Which prana?
Jnana prana.
Yeah. So it's basically Vyana Vitta in Tridosha, Vyana Vata in Tridosha, and prana is Vyana Prana in pranic channel. Right? Okay. Then it is going to affect the pitta. Pitta means what are the pranas going to get affected? The first one is Samana prana, right? It's going to get affected. Then we have a problem with what? Kidney, and we have a problem.
So pana?
No, hypertension, we are not talking about excretory, but yes, kidney, so that's why apana is affected because kidney is playing a major role. Then we have a heart. So above heart, it is from heart, every time you get the prana and udana affected. Whenever it comes to heart and respiratory, respiratory is totally with the udana and prana is head and heart, right? So it is also getting affected. So almost all the 5 are getting affected in hypertension, like your entire body is affected.
Yeah.
Every place, because also the blood is circulating everywhere, so everything. That's how you relate it with the Ayurveda. And then because of the blood circulation, what the first thing is going to get affected is your thermoregulation, the temperature maintaining of the body. Okay. So, to reduce the thermoregulation, what are the pranayama you can give? The first important pranayama is Chandrabhedana and Shita, Shitali and Sitkari to reduce the pitta. Okay. So, that we will write in the pranayama. So, ahara. What is pitta? What are the food we take normally? Tell, fast, pitta increase.
increase or decrease?
For increasing pitta, what are the food we take? Just tell me that. Through which the pitta increases? Kapha. That is kapha. I am talking about pitta. To increase the pitta, what are the food we take?
Yes.
We are not increasing here. I am asking to increase the pitta. What are the food we take normally?
Chili, ginger.
No, not the food. I am talking about the shadrasas. Yeah, the taste.
Spicy.
Spicy, what is that? Yeah, very good. Then tikta
Yeah.
and lavana. This is salty. This is for pitta increasing. So here pitta is already increased. So what we are going to reduce first? All this thing should be reduced. Lavana. What is lavana? Salty. So salt has to be reduced for the first.
Salt, spice, and what was the
Salt,
second?
sour, bitter and spicy. The chili, you want to give me the example, it is salt, this is tikta is bitter, and kattu is chilies or anything like pepper or something, and bitter is bitter gourd. So when you have hypertension, you avoid this.
When you have hyper.
Hyper.
We are always talking about hypertension, right?
We are talking about hyper because majority of people have
Always
hypertension.
listening
Hyper. Just think about hyper. Whenever I am telling hypo, I'll mention it clearly, okay?
Okay.
So we are going to reduce this 3 taste first.
Okay. So, okay.
Clear?
Yeah.
Yeah. Now what to take more?
Sweet.
Which reduces pitta.
Yeah.
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 What reduces pitta?
Madura.
Madhura,
Sweet.
rasyaha and
इसको लिंक दीजिए ना
क्या चीज?
ये जो आप बोल रहे हो,
घटाने के लिए मधुरा it's sweet. This is the best, but other two we cannot use in this. Why? Because it also increases vata. Vata should be reduced also here, right? So only we can stick to madhura.
ये sweet चीज
Okay, because
Sweet, madhura is not sweet. Madhura is not sweet, okay? Madhura is which property of a food. Rice is not sweet. Rice is madhura. Dals, pulses, lentils, vegetables and your fruits. No. वो कार्बोहाइड्रेट्स होता है, पिपली है जो एंट्स खाती हैं वो कुछ भी, ल्यूब्रिकेशन। मधुरा का डेफिनेशन है सुस्निग्ध मधुराहारा, जो कि हम क्या क्या है, रस्या है, मधुराहारा क्या क्या होता है। फर्स्ट मैं बताती हूँ, मधुरा which has the rasya property first, then which gives stability to the body, okay, which is liquidity, which has lubrication, which lubricates the body. These are the properties of Madhurahara. And then which is good for Hridaya, heart and mind, good for, like you feel like
ये इसके liquidity के नीचे क्या है?
lubrication, lubricated, like snigdhaha, which gives your butter, ghee, oils, peanuts, coconut, sesame. This all gives you lubrication. That's why I was thinking to explain you some sthira, which gives you sthira, like when you feel like you have kapha increase, but sthira, when you have some rice, you have dal, you feel like full, high fiber rich. Okay, when you have good vegetables and fruits, you are like, your body is having more amount of sthirata. Minds, buddhi and physical sthirata. Buddhi also sthira. You should not be like, oh my god, no, what I have eaten, I'm not fine. Okay, that gives you sthirata. These are the properties. Okay, so Madhura has every good thing. Whatever you eat, like the healthy food in nutrition you say today, everything comes under the Madhura. And our food, 90% of our food is Madhurahara.
Can you just